And so here are some of the signs or the symptoms of depression. If you have persistent sadness, emptiness, hopelessness, if there's a loss of interest or pleasure in doing activities that you used to do for fun, perhaps it was things like going out with your friends. If you no longer do those things or even have a desire to do those things, then there might be something there. My name is Dr. Philip Sarpon. I'm a clinical psychologist, and what I do here on this channel is talk about all of the things related to psychology, wellness, and graduate school, whether you notice depression for yourself or maybe for a family member or a friend. In fact, one of the really cool things about treatment that we've noticed from depression is that when people can, at least to some degree, force themselves to do things that they used to do, maybe it was going out to eat, maybe it was going out to the movies, maybe it was exercising. If we can actually start backwards, so start at the behavior and work backwards towards the thoughts, then oftentimes we can change elements of the depression. So for example, a lot of times therapists, psychologists, and psychiatrists will try and help motivate patients to actually do something for fun, do something for yourself, go out, even when you don't feel like it, so that once you've gone out, once you've done the thing that you used to do for fun, you find and you realize, wow, I should do this more often. I don't know why I stopped doing this in the first place. And then that behavior then changes the thought, and then that changes the feeling. I think oftentimes when we think about depression, we think about all of the cognitive things that happen in our head, but oftentimes to be able to get outside of our head, we have to engage in behavior that is healthy behaviors that could then change those thoughts, those feelings, and the mood and the energy to actually help us to feel less fatigued, more motivated, and then more engaged and present in life. If we're thinking about a tier system in terms of dealing with depression, engaging in movement, exercise, pleasurable activities first, then going to the case of medications, and then actually trying for other different levels of interventions might be helpful to things like ketamine treatment, psychedelic treatment, things like that. Now, when we talk about depression in terms of helping another person, I think here's the thing that's really important. Oftentimes, for family members, friends, when we're dealing with other people that we know who are dealing with depression, it's important to understand that you're not their therapist. But really, I think what people are looking for deep down inside is the feeling that someone is listening to them, that they can call or text someone and they're going to respond and they're going to be there for them if they need them, that there's no judgment, right? You're not adding another layer of guilt or shame in terms of what that person's already feeling, that you know that that person knows that you're there for them, whether by your physical presence, by holding their hand, by hugging them, by telling them and affirming them how much you mean to them, by, if it's for religious or spiritual context, praying for them, and you will be there for them when they need you. Depression can often make you believe that nothing will change, but I do want people to understand that recovery is possible. And one of the things is that you don't have to do it alone. There are people in your life and even professionally that can also help you. If you found this material to be helpful, please go ahead and like and share this video, subscribe to our channel, and hopefully I will see you all in the next video.